Thank you, Siddharth and Agnivesh. I'll be talking today about the orthopedic implant. Orthopedic implant is very close to every orthopedic surgeon because it's like bread and butter for all of us. Every patient whom we are going to take in the operation theater, he needs an implant either for a fixation of a fracture or for a replacement of a joint or any other procedure. So now, if you see, it's basically a biomaterial device, essential for every orthopedic procedure. But biomaterial is a substance or a combination of substances other than drugs, synthetic or natural in origin, that can be used for any period of time as a whole or part of a system that treat, augments, and replaces any tissue, organ, or function of a body, basically related to the musculoskeletal system. Now, again, it's a medical device where we are replacing part of bone or part of joint or damaged bone or maybe a fracture fragments. Now, most commonly used metals or polymers in orthopedic practice may be made of stainless steel, cobalt chromium alloys, titanium alloys, or ultra high molecular weight polyethylene or polymethyl methacrylate. Basically, it's fabricated with the help of steel or titanium, and the coating or end of a bone or weight bearing area or a joint surface or bearing surface is made up of like articular cartilage, it may be made up of ceramic or a plastic. Now, if we see, we commonly describe a procedure called internal fixation. In that, we are basically dealing with the fracture patients. We are fixing the fractures. When we want to fix the fracture, what we do, we reduce the fracture and we want to hold these fracture fragments together with the help of some metallic device or implant. And this metallic device or implant will help you in keeping alignment of a fracture fragment till they unite or till biology takes over. Once fracture heals by a natural method of fracture healing, then the implant is not required, and that implant can be removed after a period of 18 months or 2 years. Now, basically, broadly speaking, implants can be classified as a permanent and temporary implants. Permanent implants are kept in the body of a patient whole of his life, like joints, where a hip joint or knee joint or ankle or elbow or shoulder, these joints replaced, and these joints can be left are to be kept in the body of a patient for a lifelong. And another group of implant is a temporary implant, where these implants are used for a temporary purpose, like till fracture heals or fracture unites. Now, newer molecules like biodegradable implants are coming. There are various implants available which are not necessary to remove after healing of a fracture, and they degrade on its own in the human body. The advantage of these implants is they do not give you shielding effect, where because the Young's modulus is similar to the bone, and the complications related to implant removal and other things can be avoided with the help of temporary implant, with the help of bioabsorbable implant. Now, when we consider any orthopedic implant, we have to, we come across various mechanical properties like wear resistance, corrosion resistance, whether it's a biocompatible with the human tissue, or whether it is getting osteo-integrated, like bone is growing inside the implant or on the surface coating of an implant, which is like hydroxyapatite coating is given on implant, and in that the bone grows inside and which holds it together. Now we understand some basic terms like stiffness, rigidity, elasticity, and plasticity. These are all related to the mechanical and structural property of an implant. Now, stress is a force applied per unit cross-section area of a body or a test piece, and strain is a change in millimeter as a fraction of original length. It's a relative measure of deformation of a body or a test piece as a result of a loading. Young's modulus of elasticity is a stress per unit strain in the linear elastic portion of a curve. Similarly, ductility and brittleness. Brittleness is a material displays elastic behavior right up to the failure. Other some terminologies like strength, fatigue failure, and notch sensitivity. These are also related to the various implants. Ultimate tensile strength is the maximum amount of stress material can withstand before it fractures, before fracture is imminent. Toughness and roughness, these are related to the surface finish of a material. Now the mechanical properties mainly important from our point of view: Young's modulus, Young's strength, yield strength, ultimate tensile strength, fracture toughness, and elongation at a break. These are 5 important mechanical properties related to the implant. Like Young's modulus and density of common biomaterials is lowest in the cancellous bone and highest in the cobalt chromium implant, which is around 210. Titanium is moderate, around 110. Cortical bone is 7 to 30. Similarly, when we compare these metals, the Young's modulus is more in cobalt chromium. So if Young's modulus is more, then definitely the bone is the metal is more strong, and there is a difference between the bone and the strength of a metal. So that can give rise to a stress shielding, which we'll see in subsequent things. Now, as we say, Young's modulus larger Young's modulus than human bone. The stress is not transferred to the adjacent bone, which leads to the osteopenia under the adjacent to the at the junction of a implant and at the bone, and this may lead to a fracture at that particular site. That can be a pathological fracture. Fatigue strength is another important mechanical requirement for orthopedic implant, especially in the joint replacement, where cyclical loading sitting and is calculated, and the fatigue strength of an implant is calculated, and it is useful for knowing the life of an implant. Now, wear resistance. Wear is again inevitable problem of a joint replacement, where there are relative motion between two surfaces under loading, resulting in micro particle or debris. These debris surrounding the implant, they come from polymer, metal, or ceramic particles, and these produce some reaction there, maybe a chemical reaction or maybe a mechanical reaction. Chemically, the chemical release of ions into the solution surrounding the implant can give rise to consequences related to the metal ions. And similarly, mechanically, these particles can be released there in the vicinity of an implant, and they produce a various various reactions there, which can lead to a failure or aseptic loosening of an implant. Now, factors contributing to joint replacement wear, like it may be related to patient, activity of patient, cultural demands, BMI, like weight of the patient, comorbidities, and implant factors like whether it's a monoblock or multiple modular implant, or whether it's a thickness of ultra high molecular weight polyethylene, fixation methods used, implant constraint, bearing material use, surgical factors like soft tissue balancing, especially in the knee replacement, the surgeon's experience, or third body wear, or implant orientation. These all can contribute for a aseptic loosening. This can also give rise to synovitis. This can lead to systemic distribution of these debris can go into the system and can give rise to a systemic effect. Immune reactions can also be produced because of this debris there. This may also increase friction in the joint and can lead to a failure of an implant or a joint. Similar now, corrosion resistance is also of a great concern, particularly in metallic implant when we are using in vivo. The human body presents aggressive environmental situation where fluid consists of various cations like sodium, potassium, calcium, magnesium, and anions like chloride, phosphates, bicarbonates, amino acids, proteins, and dissolved oxygen. So electrochemical corrosions tend to occur in metallic implant surfaces and corrosive physical environment over a period of time. The released degraded product such as metallic ions, particularly chromium, cobalt, nickel ions, excess can lead to a toxic failure. Now, biocompatibility, as you know, any implant should not harm an individual or should not harm any tissue or host tissue. And it is very critical that implant materials are non-toxic and they do not produce any systemic or local side effect to the individual. So host resistance is very important. Metal ions released from metallic implant in the adjacent tissue may activate an immune response there and can sometimes produce a hypersensitivity and can lead to a loosening or a failure of a implant. Biointegration, we know that the metal surfaces sometimes they are coated with hydroxyapatite and some have bone ingrowth inside the surface of these implants and they integrate with the human bone or human tissue. Now, bone biomechanics, as you know, bone is a composite dynamic form of specialized hard connective tissue, which is anisotropic and composed of cells and extracellular matrix. Now, its elastic modulus depends on direction of loading, weakest in shear, then tension, and then compression. It also has a viscoelastic properties. The stress strain characteristic depends on rate of loading. Bone density also changes with age, disease, and use or disuse of a limb or extremity. Also, there is a continuously bone remodeling going on along the line of stresses. So how should be the ideal implant? It should be chemically inert. It should be non-toxic to the body. It should have a good strength. It should have a high fatigue resistance, low elastic modulus, absolute corrosive proof, and good wear resistance so that they do not produce a microparticles inside and they do not cause a loosening, aseptic loosening, or they do not produce an immune response inside the body. And it should be very easy to manufacture and it should be inexpensive. Now, basically implants are used for osteosynthesis, joint replacement procedures, and non-conventional modular tumor implants. These are all custom-made implants which can be used for reconstruction of various extremity tumor surgeries and spinal implants. These are also made up of titanium and stainless steel, which we are going to see. Now, various materials which are used like stainless steel and titanium, some alloys of stainless steel like cobalt chromium alloys, and some non-metallic implants like ceramic, bioactive glasses, or polymers like bone cement and polyethylene. They are also used for manufacturing these implants. Stainless steel is very commonly used and cheapest material available and very easy to make. So with some modifications, like we have some 316 low carbon stainless steel that is very important, and it has very good properties. Like 316 contains less carbon as compared to regular 316 steel, and it is better corrosive property as compared to 316. Now, advantage is a strong material, relatively ductile, biocompatible, and it's very cheap as compared to other metals, and reasonable corrosion resistance, especially when used in the form of alloy. It can be used for manufacturing or making of screws, intramedullary nails, or external fixator. Only disadvantage is coercive and some stress corrosion is observed. Some modified or alloys of stainless steel, cobalt chromium alloys, is initially they were used for making dental implants, and now with some modification, they are now used for making a joint replacement implants like a hip and knee surgeries. They have very high fatigue strength, high modulus, elastic modulus, high degree of corrosion resistance, especially in salt water, poor frictional properties with itself and with other material. That is a disadvantage of these alloys. Molybdenum is added to produce finer grains into these implants. Cobalt chromium alloys have an advantage of excellent resistance to corrosion, excellent long-term biocompatibility. It is stronger as compared to stainless steel. Disadvantage, very high Young's modulus, so there is definitely a risk of stress shielding, and they are expensive as compared to stainless steel. Another important metal which is useful for making implant is titanium. It is the ninth most abundant element in the earth crust and pure form. Pure element is very reactive. It is only element that burns in the nitrogen. However, the metal rapidly becomes coated with oxide layer, making it physiologically inert and resistant to the most chemicals. Titanium is used in the pure form or in the alloy form, where aluminum where aluminum and vanadium alloy is, is made used for making a implant. Now advantage is corrosive resistance, excellent biocompatibility, ductile, fatigue resistant, low Young's modulus we have seen before. It is a MR compatible. So after using titanium implant, patient can be subjected for MR. Useful for making hollows, plates, intermedullary nails, various spinal implants and custom made implants, and even joints are being made with the titanium alloys. Not sensitivity, poor wear resistance, sensitive toxicity observed with vanadium alloys, and relatively it is expensive. Another implant made from titanium is nitinol, that is nickel. It is a shape memory alloy which can be molded into various shapes based on the temperature at 0 degree, and can come back to its original shape at temperature of 37 degrees or more. Ceramics are mainly two types of ceramic, bioinert and bioactive ceramics. Bioinert ceramic material possess excellent wear resistance, high compressive strength, inert chemical inertness, and biocompatible. Compounds of metallic elements, example, aluminium bonded ionically or covalently with the non-metallic elements commonly used are alumina, silica, zirconia, and hydroxyapatite. Ceramics have advantage chemically inert and insoluble, best biocompatibility, very strong as compared to other metals, and osteoconductive where bone ingrowth can takes place inside the ceramics. Disadvantage is very brittle, so cannot be used for making a stems of the implant. Very difficult to process, high melting point, and they are relatively expensive because of the making is difficult. Now they are used for making femoral heads, or even they are being used for making components for the total knee replacement. And these are very brittle, so they cannot be used for making the stems. Polymers consist of, as we know, polymethyl methacrylate and methacrylate, that's bone cement we commonly use for fixing our implants to the uh, bone. And these ultra high molecular weight polyethylene, UHMWPE, these are used for bearing surfaces in the joint replacement surgeries. Now, bone cement is very frequently and commonly used material. It has monomer and polymer which are mixed together, and exothermic reaction takes place. But now this goes through various stage like standy stage, mixture, appears stringy, cement is doughy, and cement become hard. Once it becomes hard, it usually fixes the implant to the parent bone or parent tissue. These are uh, bearing surfaces made up of ultra high molecular weight polyethylene, and these are commonly used for total hip and total knee replacement surgeries. Wear is very common because of the microparticle getting released into the joint surface, and this can lead to a septic loosening. Now, biodegradable implants and polymers, polyglycolic acid, polylactic acid polymers, they are being used for making various implants, and these are biodegradable implants. No need to remove hardware after fixing the fracture fragments. Usually used for fixing small bones like phalangeal, or even they are used for fixing the ankle fractures and elbow fractures. Now, these implants, when they are put in the human body, they produce some responses. All implant material elicits some response from the host, and these response depends on various factors like tissue, where it has been put, mechanical load, amount of motion and composition of the implant, age of the patient. They may produce a toxic response. Implant material release chemical that kill cells and cause systemic damage. Biologically inert, nearly inert, most common cause tissue response involve formation of non-adherent fibrous capsule. When we remove implant, sometimes you might have seen a fibrous layer or a capsule on surrounding the implant in between the bone and the metal sometimes. And this fibrous capsule is an attempt to isolate implant from the body, and this is formed in response to the implant. Implant may be surrounded by bone also. Sometimes during implant removal, we might have seen implant is totally incorporated inside a bone. Can lead to fibrous encapsulation, as we have already seen. Depends on whether implant has smooth surface or porous coated, threaded surface, metal alloys, polymers, or ceramics. Dissolution of implant, like resorbable implants, are degraded and ultimately they are absorbed in the human body and they metabolize to carbon dioxide and water. Bioactive response, implant forms a bond with bone via chemical reaction at the interface, like in the ligament surgeries. They form a carbonate apatite on the implant surface and it acts like a natural interface between bone, tendons, and ligaments. Now, complications of these implants, like we have seen aseptic loosening because of the wear particles causing osteolysis. That's again a response of the human body. Body's reaction to the wear debris. Stress shielding we have seen because of the difference in the density. The implant has can lead to a osteopenia or a disuse atrophy at the edges and can lead to a fracture there. Corrosion reaction of an implant with environment resulting in its degradation, oxides and hydroxides. Infection, colonization of implant by bacteria and subsequent film formation and can lead to a disaster and implant failure. Sometimes metal hypersensitivity is another concern for in some patients. Manufacturing errors can also lead to implant failure, which we have to understand and keep in mind. Now, if we'll see brief history how implant has revolutionized. Like Sir William Arbuthnot Lane, British surgeon, he was early pioneer who placed plate and screw fixation on sound footing. He devised his form of plates, and this called stout steel, high carbon steel of fairly high percentage of carbon. And he also devised no-touch technique to prevent wound infection, and his own results bear testimony of great skills. However, he and many other surgeons failed to distinguish between real wound infection and wound caused by corrosion of metals. His implants become brittle in nature and cause break at the junction of bar and first hole, and this leads to failure. Sir William Arbut Lane, Lane was popularizing his idea in United Kingdom. Lambert brothers, Ely, and especially Eldin were working in Belgium on fixation of fractures. They used metals like aluminum, silver, brass, magnesium, copper plates, and steel coated with gold and silver. Their plates were curved and they were custom made and made to fit to the curvature of a bone. The total disintegration of magnesium plates used with steel screws underlined the effect of electrical corrosion, which was observed in their observation. And when two separate metals were used, that's why usually they prefer to use a single metal. Sherman's plate, as you were aware, they were improved design of lens plate to make it stronger. His implants were made of vanadium steel and alloy containing less carbon. In spite of this, staining of tissue was found, indicating iron corrosion product. Von Boyer in 1908 introduced pins for fixation of small fragments. And he was the first to use round pins for fixation of femoral neck fractures. And this idea was gotten till revived by Kuncher in 1940, and Ernest William Hegrews, they used intramedullary nails. Now, basically, this is a history part. And as you know, this evolution, we have seen this Smith-Peterson nails, Magluglin's plates, and Jewett nail plates. These are the same as angle blade plate, where fixed angle blade plate. These implants were used and made up of stainless steel and used for fixation of a fracture. Now, as you know, Kuncher is a pioneer for intramedullary nails, and he made these nails in the cloverleaf shape for femur and V shape for a tibia, and later on uh, there was a lot of research and the design or concept has changed, and we have all first generation, second generation, third generation nails, but metal is mainly stainless steel, and now we have titanium made nails. Stanley gave a concept of compression plating. Similarly, in 1958, AO Group has come up with a idea of fixation, rigid fixation of fracture. They come with a lot of they have done a lot of research for developing various implants in various designs. They have come up with their own designs, and these were used for fixation of a fracture. And that concept of AO is again getting evaluated and getting changed every now and then based on the need of our. Now, aim is to use material with mechanical properties that match that of bone. Basically, we are looking for a implant which has same yield potential as compared to the bone, so there is no shielding effect. Modification of existing material to minimize harmful effect. For example, nickel-free alloys been made. Possibility of using anti-cytokinin in prevention of osteolysis around the implant, and some using antibiotics and coating of an implant to prevent and make it as an antibacterial implant. Currently, we have all we are moving towards biodegradable implants. Most of these biodegradable implants are used for fixation of ligaments, tendon, meniscal, and other soft tissue structures. Especially the interference screws and transfixion screws are used in arthroscopic surgeries. These are also biodegradable implants, and these are very useful. Once the purpose is served, they get degraded inside the body. Now, they are also used in pediatric situation for fixation of facial fractures or ligament fractures. Now, they are also used for fixation of ankle fractures. But issue with these biodegradable implants, there is a chances that the mechanical strength is not as good as stainless steel implant or titanium implant. So, biodegradable screws can break when you are putting inside. So, we have to keep that particular thing in mind. Now, there are some disadvantages of these biodegradable implants. Primarily, their inadequate stiffness. They also produce inflammatory response, foreign body reaction, and sometimes these implants they last or degraded very at slow phase. So they are as good as metal implant. They don't serve much purpose. So we are looking for implant which will have a midway. They will get resolved in 16 months to 18 months time. Some modifications like colored implants being used, but they also produce a inflammatory response. Now these are implants, biodegradable implants can also be used as a, they are resorbable plates. They are used with bone morphogenic protein coatings covalently, and this is used as a delivery technique, where at the fracture healing, for fracture healing, we know this bone morphogenic protein is important for induction of a process of healing. So once these plates are coated with bone morphogenic proteins, once the healing process starts after fixation of fracture, these definitely bone morphogenic proteins can slowly be released at the site of fracture, and it can induce the process of healing. Various growth factors can also be coated along with the biodegradable implants for inducing the process of healing. And as we know, we are looking for medium term degrade implant which will make our life easy. Yeah, antibiotics are also used with these biodegradable implants in the form of microspheres and beads, especially in case when we want to treat a patient of infection like in joint replacement or trauma, fracture patients. These are biodegradable implants, microspheres and beads can be used as a delivery system for antibiotics. Adequate knowledge of implant material is essential platform to making best choice of implant. No complete satisfying results are use of existing implant materials. Advances of biomedical engineering will go a long way in helping orthopedic surgeons to get a new material. These are all implants used for making joints where you have a metal implant here, metal head, stainless steel head, or with some alloys, or which is an ultra molecular with polyethylene liner is being used. Now, implant, once we use inside a body of patient, we have to give them some certificate or some card. So these companies, along with some hospitals, they provide these identification cards which are useful for them when they go abroad and when they have to clear the security. So these implant cards can be issued to the patient, especially for a joint replacement patients, or even to the patients with intramedullary nail or a plate or trauma patients. This is a very important thing. It is our duty actually. In addition, we can write an instruction there on the card itself, so that if these patients they develop some infection, so they have to be treated with prophylactic antibiotic, or if they are undergoing procedures for dental work or sigmoidoscopy or proctoscopy, cystoscopy. So these and other instructions like can also be mentioned on the card, which will be very handy and useful for a patient. Along with that, we can give contact detail of a hospital personnel. So in case of emergency, they can contact the doctor or a team member of a doctor. Another important thing we have to understand with this metal is the medical legal aspect. So these companies usually implant failure. Once implant fails, the patient thinks it's because of a surgeon, or it's because of a poor quality of an implant. They will never understand that if doctor has asked not to bear weight before union of fracture and patient started walking or moving around without any additional or external support, or without even a walker or walking aid, in that event, there may be a fatigue failure and the implant may fail. So it is our duty to educate these patients and give them in writing, or like it should be part of our consent, where we tell patient that this particular fracture is being fixed with intramedullary nail and you are not allowed to bear full weight without external aid. And if you bear weight, or if you do any muscular activity, or if you do any sports activity, there is a high chance that implant may fail. If we instruct the patient beforehand, then definitely our liability or medical legal issues will be minimized. So as a part of our operative consent, we should also make implant consent, and we instruct patient based on the implant used. We educate him what is the make of the implant and what is the other features of the implant, and how it's like lifelong implant. Again, we have to explain them that how much is the life and what are the other complications like aseptic loosening, failure of implant, and revision surgeries. That should also be educated during that particular time. Thank you very much for your patience.